Welcome back to your follow-up appointment. How are you doing today?
I'm doing great, honestly. I have been recently thinking about making some changes in order to feel better about myself.
That's great to hear. It's always good to stop and reflect on your daily life and strive to be the best you can be. Today, we'll be following up on your oral health, and I'll pull up some previous x-rays to see if there's been any changes.
Sounds good, no problem.
Perfect. Now, Samantha, has there been any changes to your medical history recently?
Yes, recently there has been a change to my medical history. I started taking antidepressants to help with my mental health.
Alright, could you provide me with the name of the antidepressants you are currently on?
I'm currently on Wedeburn, 300 milligrams daily.
Okay, thank you. I will make sure to add this to your medical history. Last time you were here, you informed me that you were smoking for about 2 years now, 10 cigarettes a day. Have there been any changes to this?
No changes. As of right now, I'm still smoking about 10 cigarettes a day.
Okay, thank you for your honesty. How soon after you wake up do you have the urge to smoke?
Probably with about 30 minutes or so. It differs day to day. Some days my stress is worse than others, but my antidepressants have really been helping me out recently. They help reduce my stress, and sometimes they need to forget to smoke, which sounds like a good thing.
Yes, that's good to hear. But you have to remember, it's not that easy. People around you may be a trigger to make you smoke again. Does anyone else in your household or close friends, maybe family, smoke around you?
Some of my roommates sometimes, but not consistently, only here and there.
Alright, and how interested are you in quitting smoking?
As of right now, I am willing to quit smoking. I'm stressed with school, the passing of my father, but I am willing to increase my overall health as I have not been feeling very good lately. I have joined a support group since our last visit, and I feel like it is helping me a lot. I have also been taking medication for my anxiety. It seems like to be helping, and that's why I feel like I might finally be ready to quit.
First, I would like to begin by saying that I am so sorry for your loss. I totally understand, and I support your decision to try and quit smoking. It is good that you are setting aside all of these things to ensure your overall health is maintained.
Thank you.
So while I'm doing your intraoral exam, do I have permission?
Yes, you do.
Perfect. Alright, and then I did your extra oil, and then we do your intraoral. But I'm not going to do that because I don't have anything here. I'm seeing that your gums are more inflamed and red compared to your last appointment. And there's some bleeding when I'm examining the gums health. Are you aware of how smoking may have impacted your oral health? Or when are you going to look to quit?
I am aware of how smoking impacts my oral health, as it impacts my gum health and increases my chances of getting cavities. That's why I'm willing to quit within the next few months to help with that.
That is great to hear. What motivates you to want to quit?
Wanting to take care of my oral health and overall health while being happier with my smile without feeling self-conscious about people staring at my teeth and gums. Despite how stressed I am about school while still going through the emotions of grieving my father, I want to do better for myself and become healthier with my lifestyle choices.
That is great to hear, Samantha. Now, who's your support network for quitting?
I'd say mainly my friends at college who are always around me and help motivating me to stop, and then my mom also really wants to help with my future and health as well.
To help with cutting down on your daily cigarette intake, I'm recommending that you remove all tobacco-related products from your home and school environment and perform behavior modifications such as changing the location-associated activities with your tobacco use when trying to reduce the amount of tobacco leading up to your quit date.
Thank you for that information. I will make sure to remove any distractions and keep a clean space for me to be able to quit.
It is very critical to try and overcome urges and stay abstinent from tobacco use in order to prevent relapse. With cravings, I recommend an RT gut. If constipation takes place during use of this, I recommend an increase of water intake, consuming healthy fats, and the intake of Metamucil. If you experience increased levels of depression, speak to your medical professional for alternative antidepressants to help aid with those side effects. Or you could look into exercise to get your body moving and do journal entries to help your mind. I know that helps me. If you experience insomnia, rest 1 hour before bed by doing things to relax your mind, for example, reading a book. Another way to help with insomnia is by increasing the amount of daily exercise to help move your body.
Wow, I never knew there are so many symptoms that may occur when quitting smoking. This really opens up my eyes to the difficulties of quitting smoking. I will definitely keep myself peeled for these symptoms to ensure that I treat them correctly to try and prevent relapse for myself.
Perfect. What are some examples of things that trigger you to smoke?
I notice that whenever I go to my friend's house and I see their parents together, they're kind of taking care of each other, and it puts me into like that depressive episode and makes me feel that like strong grief towards my father. I also can't really keep up with due dates for school right now. It's been really stressful in that sense. And I've come into problems with money since my father's passing. There's been a lot of like tightness in that situation. And then I just feel like I'm getting a lot of stress from like the weight gain from anxiety, so that kind of triggers me to smoke as well.
Thank you for all the honesty about the challenges you are facing. I really respect you opening up to me. Now, if you're okay with it, I would like to talk to you about ways to strategize and overcome these barriers you're facing.
Of course, I would love the guidance.
Okay, so let's first consult with the trigger of seeing your friends' parents together. I would recommend seeing a therapist about the emotions you have in regards to seeing other fatherly figures, which in the future can help to attempt to alleviate these triggers you are facing that lead you to smoke in these situations.
I definitely want to make sure to look into therapy. I do think my school actually has options for getting that covered with financial situations, so I will definitely look into that.
Perfect. Now let's consult with school stress, triggering the need to smoke. Have you ever considered reducing your course load until you learn to overcome these challenges? Also, when it comes to money, this should also play a major role in reducing stress about your tuition fees, leading to the need to smoke.
That's actually a really good idea. I'll make sure to talk to the student counselor and see what I can do in regards to how I take my courses, and then talk to my mom, of course, to see what she thinks of it.
Perfect. So, as for your concerns with your body image, reducing your course load will give you the free time to focus on a healthy diet and more time to work out, to focus on yourself, but maybe you feel a bit better, and this could alleviate some of the smoking sensations you have during that.
I honestly have always wanted to like work out, get into a better like habits, diet, and look into those things, so this all sounds so amazing.
Perfect. How much would you say you take in an alcohol week?
I would say it's more casual, like 3 to 4 drinks a week on the weekends, and me and my friends all go out and try to get all that stress away. So not too much, just more casual.
Alright. Well, in order to help prevent relapse drinking, you must be also willing to limit the amount of alcohol you consume in order to prevent relapse from taking place.
That honestly sounds totally okay. Like I'm willing to look into it to make sure I maintain that proper health for my quitting process.
Also, nicotine replacement therapy is a very effective way to help individuals wean off of tobacco use. Have you ever considered it?
I haven't, just because I don't know too much about it right now, but I'm willing to learn and get to know anything that is possible to help me quit the right ways.
Oh, don't worry, I can help explain some good products.
I would love that.
First off, there's Nicorette gum, which is an alternative nicotine. It costs about $49.99 at Shoppers Drug Mart. Then another choice could be using Nicoderm patches for $71.99 at Shoppers, or you could use a nicotine inhaler by Nicorette, which is $47.99. If you have more questions about these products, please follow up with a local pharmacist. This can help increase your chances of quitting by 55% in an 8 to 12 week program. You can also look into combining these options to help with better success. If you want, I can talk to dentists to write up a referral so you can confine in a medical doctor for further details.
Those are all great options. As soon as I have time, I will definitely consult a pharmacist to see which might be to me best during my quitting process, and I would love the referral to a medical doctor to look into that.
Perfect. I love the motivation. Also, if it's okay with you, I would love to provide you with some resources that can help you during your quitting process. This pamphlet here provides you with free educational materials and a quit plan called Information on Smoking Cessation Behaviors, or if you would like, there are also online resources such as www.unsmoke.ca from the Canadian government, or if you prefer, I can provide you with some support groups that are local, such as the Canadian Cancer Society.
Thank you. I actually really appreciate your help. I will sure look into those resources online. It's hard to find time right now with school and everything, but I would love to look into those support groups, and I'll definitely take a look at this pamphlet.
That's perfect. Whatever works for you. All right, Samantha, you are good to go, and we'll book back a follow-up appointment 7 days prior to your quit date to see how you were progressing.
Thanks so much. Have a great day. We're at 10 minutes almost.